There's been a lot of conversation and consternation about artificial intelligence and its role in our society. Can platforms like ChatGPT be trusted? You'd probably say, sure, for writing a customer service complaint or cover letter, but how about diagnosing what's ailing you or considering medical ethics? Joining us live now with the results of his new fascinating studies, Stanford Assistant Professor and Faculty Director for Medical Education in AI, Dr. Jonathan Chen. Dr. Chen, nice to have you on the show.
Thanks, Kristen. Great to be here.
All right, so this is super fascinating. You've done a couple of experiments that compare human doctors and AI, and I got to ask you why. I assume it's not just to prove human supremacy and justify the high cost of medical school.
All of the above. I actually wanted to do this for 20 years. When I was in medical school, having to memorize bugs and drugs, like, surely a computer could do this better, but it kind of wasn't up to snuff for many years. And now disruptive technology arrived, ChatGPT and similar things show up in the past couple of years. Whoa, it's kind of like the internet just got invented, and we have to rethink how we do all sorts of things, because medicine in particular is a high stakes area, high complexity, high need for a lot of more support.
Right. Okay. So you're like, okay, let's just see. So in this first experiment, I guess you looked at who's better at diagnosis, right? So explain the setup and then tell us what you found.
Sure. Leading up to it, we've already seen now these models, they can answer multiple choice questions really well. Yeah, but that's not what we do in real life. Then we tried these complex, a case vignette, a patient history, patient story, relevant information and irrelevant information. Weird. This stuff can even answer that in an open-ended way pretty well. Still not relevant. AI can do something cool. We're not going to let robots take care of patients yet. So the real studies we dove into here is complex case vignette, real doctor, take this, randomize to, you can use anything on the internet, go look up anything you want, just don't talk to a chatbot AI system. The other half you're randomized to, you can use, essentially use GPT-4, an AI chatbot system, and see who does better. And really weird, we've had two studies now, one in diagnosis, can you guess what it is and can you explain why? The computer actually did better than humans plus computer. That was absolutely not what we expected. And another study just came out a month ago, complex management decisions, not just diagnosis. What would you do for this patient? What treatment would you pick? And what do you do if there's a complication? Even then, the computer does as well as human plus computer. It's just surprising finding we did not expect.
Okay, gosh, I want the human side to win. Let's take a closer look at the numbers from one of your studies in which you looked at, AI alone and then doctors without AI and doctors using AI. Are these numbers correct? What are we looking at here?
This is a score on a complex medical reasoning exam on how good their diagnostic reasoning skills. Not just getting the final right answer, that's one thing, but also can you explain why? It doesn't help if you can't go with it. And this is not what we expect. We thought doctors with AI, without AI, it's a hard test. With AI, it should make them better. 74 to 76%, it's a little bit better. Surprising it didn't make that much difference. Really bizarre because the AI alone does really well in this exam. In this case, it got a score of 90%.
Oh my gosh. Okay, this is Dr. Rodman, who is your partner in the study, so you guys did that together. So this is really telling me, I mean, should I be interpreting this as, oh, we should just get out of the way because the AI is doing fine on its own?
That is, I would say, this really flies in the face of the fundamental theorem of informatics. I used to always say this because it sounds good. Human plus computer, when combined, will deliver better results than either would alone.
That's right.
Now I'm a little bit unsure. I don't say that as much. What does this mean?
Yeah.
What I actually think it means, obviously the combination is better, but it's a whole new tool. Most of the doctors in the study at this time, they didn't even know what a chatbot was. They really just didn't know how to use it. And that's why I've taken on this medical education role, because in addition to tech development, we clearly need to train and retrain all of us on how to use powerful new tools.
Okay, just because I'm not willing to give up yet in saying that we humans reign supreme, I want to dive a little deeper into the second experiment that you talked about, the one where you're asking it to make tough medical decisions like reasoning, so what about treatment? What about this? Ethical things. And I'm thinking surely humans do better on that, right? Because it's not just like look at the symptoms, figure it all out. It's not just factual. It's like dealing with biases, dealing with empathy, all that.
So here, at least human plus computer was comparable to the computer. These are much more complex, nuanced questions. The humans do offer a lot here. But one of the things we're finding is having a computer to talk to go through your answer actually is helpful. It helps remind people to think about even a patient is a person. It's not something we're just prescribing medicines to, and actually can help with some of the nuances.
Wait, okay, okay. So right there, you kind of said that maybe the AI is only successful because it's helping us be us, like bring out the best in us so that maybe we're still the better ones.
I mean, really, one's better than is kind of arbitrary, but I'm actually with you. I think human actually is a unique value here that cannot be replaced. But using these tools, I think, can unlock some of the best of us. And some of the anecdotal experience that I have, I just tried to practice counseling with these chatbots, and whoa, this thing seems to provide better counseling than I have even. What does that mean? After I got past the existential angst of that moment,
Yeah.
wait, this is actually really powerful. It could help practice and let me train to be even better
Can
at
you give me an
most
example?
human
Give me an
skills.
example. Like, what did you ask it? Like, what is the thing that really surprised you? Like, whoa.
Sure, I shared I wrote a two-page essay on this, who's training whom, where real life situation, I had a patient that had Alzheimer's dementia in the hospital, choking on his own food. I had to talk to his wife. Should we put in a feeding tube surgically to just direct feed him? Ugh, tough situation. And then I'll ask the chatbot. I wonder how it would have handled that situation because there's no way it knows how to deal with this complexity. After a few turns, it was really uncomfortable because it was providing better counseling than I think I did in real life. In real life, I kind of just got tired after a half hour talking. I said, the doctor tomorrow will keep going into it further, versus this thing was able to go much deeper in that conversation than I expected a silly computer could do, that it let me rethink, well,
Oh.
let's use this to practice some of the best skills we need and unlock the best potential to. I actually think humans do win in every case because it's our patients who need it the best.
That is true. So, in the minute that we have left, what is the upshot, right? If this AI is so good already, and I assume it's only going to get better, what does that mean for the patients, us, and for you guys as doctors?
So it doesn't mean it's ready to just practice medicine. There's still a lot of caveats and limitations, but the upshot I often describe, Warner Slack, he had a famous quote. He riffed on Arthur C. Clarke. Any doctor who could be replaced by a computer should be replaced by a computer. That doesn't mean anybody's being replaced. That means very humans actually provide specific value. But my colleague Kurt Langlois has a nice quote. He says, nobody AI is not going to replace anybody, but those who learn how to use it may very well replace those who don't. So we all clearly need to learn how to use these tools to do the best we can.
All right.
Ready or not, it's coming.
It,
Pandora's box is open.
that's right. And can't wait, by the way, for this battle bot, humans versus AI round 3. So, Dr. Jonathan Chen, please do keep us posted when you do that experiment and have some results. But thank you so much for coming on.
Great to see you, Kristen. Be in touch.